Hello and welcome. I'm Vincent McCory. This is Africa 54. Tonight, we begin with a VOA exclusive report from inside an Ebola holding center in Sierra Leone. At the Kailahun facility in Makeni, dozens of very sick people wait in insufferable conditions for help that may never come. Adam Bales was recently there and reports on what he says are some of the worst situations he has ever seen since the beginning of the West Africa Ebola outbreak.
Dr. Osman Barr, the Makeni Government Hospital Director, says Ebola cases have spiked in recent weeks.
More than 150 cases, because we've sent about 56 cases to Kailahun. And now, this morning, we had 110 patients this morning.
This university complex is being used as a makeshift holding facility.
This is one of the wards.
With no treatment centres, these sick people have nowhere else to go. Highly contagious patients lie in the open. A woman sits on the floor, too sick to stand. Other victims huddle together on beds. One young child lies alone. They wait, hoping for a space in the next ambulance. Growing numbers of outbreak hotspots are emerging in new locations across the country, says Doctors Without Borders Field Coordinator Axel van den Eyck.
We get phone calls every day from all districts in the whole country, and those districts are absolutely overwhelmed.
There is no way of telling which patients are Ebola positive. Despite this, they are all kept together. Medical staff here have little training or experience dealing with Ebola. Protective equipment is inadequate. Dr. Barr says 3 staff members have died already.
99% of the cases that we've isolated are positive of Ebola.
One makeshift ward lies empty. Beds are filthy. Pill packets sit among piles of clothes left by departing patients. 25 confirmed Ebola patients left here for the Doctors Without Borders treatment centre in Kailahun last night. 4 died during the 16-hour journey.
Every day we have ambulances arriving, and then when we open the door, there are dead bodies inside the ambulance, and non-cases, potentially, and cases. So that is the first source of contamination.
2 new patients have just been brought in. The young boy is showing symptoms of Ebola. Despite the risk, his mother will not leave his side.
This ambulance will bring 10, 15, 12 for the every day, and not my only all evening.
Dr. van den Eyck says some districts have no Ebola treatment facilities of their own.
They don't have capacity of Ebola centers in their district. So basically they're trying to send their patients to us.
Dr. Barr says he is not hopeful the situation will improve.
For now, the situation is not under control. We are hoping for the better, but I'm afraid maybe it will get worse.
The US Centers for Disease Control is warning that without massive additional international assistance, Ebola cases could spike to as many as 1.4 million by January. Meanwhile, patients wait, fearing death in a city as yet with no Ebola treatment or testing facilities. Adam Bales, VOA News, Makeni, Sierra Leone.